Janine Ariel Esteban from Section B, and I will be performing simple interrupted suture.
Before closure of wound is initiated, thorough assessment of the patient must be completed. Initial attention should be directed at maintaining the patient's ABCs and stabilizing the vital signs. Wound characteristics, anatomic site, type, and comorbid conditions affect the management of every wound. Keep in mind that all wounds can be potentially life-threatening.
So these are the following materials that we will need. So now let's start.
In evaluating the wound, in most circumstances, wounds penetrating the epidermis and dermis with involvement of subcutaneous fat will require suturing. Before suturing, take into account the following factors. One is the time of incident. Most wounds will not be closed if 12 hours have passed from the time of injury. Second is the size of wound. Third is the depth of wound. Fourth, the tendon or nerve involvement. And last is the bleeding at site. The most important step for reducing the risk of wound infection is wound preparation. All contaminants and devitalized tissue must be removed prior to wound closure. If not, the risk of infection and of a cosmetically poor scar are greatly increased. Cleaning the wound area before suturing is really needed. You can do this by using normal saline solution or other solutions such as chlorhexidine or hexachlorophene. Avoid betadine or alcohol when cleansing the wound. Irrigation is probably the most effective way to remove debris and contaminants. Method of irrigation is through an 18-gauge plastic catheter attached to a 30 to 50 cc syringe. Irrigate 1 to 2 inches from the wound, refilling as necessary to achieve maximum reduction of wound contaminants. There are three types of wound closure or repair. First is the primary closure. It is only done on lacerations that are relatively clean and minimally contaminated with minimal tissue loss. Repair is usually necessary within 8 to 12 hours from the time of injury. Second is the secondary closure. They are not primarily closed with sutures but are allowed to gradually heal by granulation of the epithelial cells and then sutured as required. Indicated in skin ulceration, abscess cavities, punctures, animal bites, and large tissue losses. Lastly is the tertiary closure. It is done in wounds that are too contaminated to close primarily. Examples are excessively contaminated with soil, feces caused by human or animal bites, and high-velocity missile wounds. Once infection have passed for 4 to 5 days, normal closure can take place. For the follow-up care, following the placement of the sutures, cleanse the suture site with normal saline. Apply a small amount of antibacterial ointment and cover with an appropriate size sterile non-adherent dressing. Depending on nature and extent of the wound, antibiotic therapy or tetanus toxoid may be indicated. Attending doctor will provide orders and instructions regarding dressing changes, suture removal, and further follow-up care. Inform the patient that the suture site needs to be checked inappropriately 24 hours for signs of infection or complications. Removal of suture. All sutures cause irritation to the tissues and have the potential to cause scarring because they are foreign bodies. skin sutures are removed as soon as tissue healing allows. It varies according to the location and depth of the wound. Ideally, non-absorbable sutures are removed from the face after a period of 5 days. Other tissues, like the lips, would be 3 to 5 days, oral cavity, 6 to 8 days, neck for 5 to 6 days, scalp approximately 7 to 10 days, for the chest, abdomen, and leg, 10 to 14 days, and last is for the soles, palms, back, or over joints, which is approximately 10 days. Any suture with pus or signs of infections should be removed immediately.
Good day, I'm Janine Kinemarot, and I will be performing simple interrupted.
Ang aga-aga baka siyansihin ko yung gilagid mo dyan.
Kailangan tahiin ng dapat tahiin.
What?
Pero wag na nating tahiin ang mga hindi na pwedeng tahiin. Ha? Nagpudot pa.